Basically, hepatitis C virus is a virus that gets into your bloodstream, affects the liver, and over time can turn deadly. It can lead to liver cancer, cirrhosis, or liver failure.
The risks are great with youth and young adult because of peer pressure, because of what they think is cool, because of what they think or feel may not have the detrimental effects down the road. Oftentimes misuse or abuse comes from a situation where a prescription was needed, whether it be for a dental procedure, whether it be for some sort of ailment from trauma, or perhaps even post-surgery. Not everyone becomes addicted, but we know how addictive opioids are, and oftentimes you do have youth and young adults that will make that quick transition from use that was prescribed by a practitioner to misuse after the fact, because they either get attracted to the feeling of the opioid or want to take that little bit of a risk and see what it's like to take it even after the pain has subsided from the actual medical or surgical event.
It might seem hard to understand, but heroin is easier to get and cheaper than prescription opioids on the street. So oftentimes young people who are dealing with that dependency and they don't know or they don't feel comfortable talking to their parents, talking to their doctors about what they're going through, they might see heroin as a viable alternative.
Heroin is easier to buy for young folks than it is to walk into a liquor store, and many in our community don't realize that.
People oftentimes start using heroin sniffing, but they transition to heroin in our study within a year. And that's where the hepatitis C risk comes very, very strong.
The transition from oral opioid analgesics to heroin just seems so far beyond what someone would do. But in today's environment, heroin's quite different.
Hepatitis C spreads via blood-to-blood contact. What does that mean? If you are injecting drugs, and if you are sharing any injection equipment, that includes the syringe, the cooker, the cotton, the water, it is very likely that you might be exposed to hepatitis C virus and you might be infected with your hepatitis C virus. Hepatitis C can be treated. There's a new generation of medication that can cure hepatitis C. So it's very important to be aware whether or not you're hepatitis C positive and monitor the status of your infection. We see a lot of young people who start using prescription drugs because they think they are safe. They think it is a medication after all. However, over time, if you keep using them, it can lead to drug dependency, can lead to heroin transition, drug injection, and overdose.
Addiction is a true mental health disorder that most folks in society are ashamed of. And if it's a family member, they want to seek treatment elsewhere so that they can hide behind this shadow. I think the work that we need to do here on Staten Island is to really break through that stigma and break through these barriers and let folks know that there are so many talented people here that can help.